I wanted to talk about how to lower healthcare costs, and I know a lot of people, it's hard to really express and kind of explain things through Facebook. So I wanted to make a video. I am a certified assisted living administrator through the Department of Health and Senior Services of New Jersey. I'm also a certified dementia practitioner through the NCCDP. I've been working with seniors even before I graduated college. It's something I love to do. Particularly, I work with seniors in the assisted living setting. Some of them have mild cognitive impairment, Alzheimer's disease, Parkinson's disease. Um, I've also worked with seniors who are in the end stages of Alzheimer's disease. It's something I love to do. I love seniors. But the reason I talk about this is because I work in assisted living, and I'm going to get to why that's significant in a moment. But first, currently, our healthcare system is run by big corporations. And how did that happen? What ended up happening was government caused a problem and then they stepped in to solve the problem, as Carly Fiorina has said, and I love the way that she explained that. With the healthcare system currently, you can only buy insurance from a select few carriers, providers, and those providers are only within state lines. So the competition is down, which means that prices go up because they can go up because there's not much competition. As a result, we've also seen monopoly of hospitals and insurance companies coming together. I'm not going to use specific names, but there is a huge hospital in my state of New Jersey that has combined with a insurance provider that has made a special plan that if you're in this insurance company, you can go to this one hospital, and in this hospital you can get lower cost healthcare, but there's kind of a catch, and if you are going to another hospital, the benefits are not so good. But the hospital and the insurance company are able to do this because not only are there select few choices of insurance providers, but there's also a select few choices of hospitals. What we've seen over the past few years is that hospitals have joined together to create bigger companies, and also private physician offices have been closing or have been joining with hospitals or medical centers to be run by that hospital or medical center. I had a private doctor for many years, and they switched to a hospital because it's cheaper for them. They don't need to pay all the accountants and the lawyers, and everything you would need to run a private practice is now covered by the hospital. But it's sad to see that we're seeing more businesses being destroyed than being created for the first time ever in American history. And that also goes with healthcare. So how do we lower the cost of healthcare? Well, I'm going to use the analogy of a shopping mall. If a shopping mall only has 4 stores to choose from, the prices aren't going to be that great. They don't need to compete with each other. And we all know those small malls, and they usually don't have many sales. But if you go to Mall of America, or in my state of New Jersey, we have the Garden State Plaza, there are thousands of stores to choose from. And it's particularly in Paramus, there are thousands and thousands of stores where the retail capital of the country, there are thousands of stores to choose from. And as a result, they have to increase their competition by lowering prices and providing quality. So when you go to those malls that have all those stores, hundreds of thousands of stores, what you're seeing is in the window, you'll see 50% off, 60% off, buy one, get one half off, newer quality, better quality, wrinkle-free, iron-free shirts. This designer teamed up here because they want to sell quality product for lower cost because they want you to keep coming back. And what happens when you find a store you really love? I am a huge fan of Lush. I love Lush, and I have convinced all my friends to love Lush as well because I think the product is great. So Lush is happy because they have provided a quality product, but at the same time they're gaining new customers. Healthcare works the same way. What we need to do is get rid of the superficial lines that are around the states so that you can buy insurance from any state, which will lower the cost of insurance because the competition is higher. I work in assisted living. Assisted living is a privatized healthcare system. We do not accept typically insurance or Medicare. And how that works, if you want to have long-term care insurance and you want to go to assisted living, Your long-term care insurance provider gives you the money. They don't give it to us. And so that makes us a privatized industry, and we have to keep our costs down because we want people to come. We are not relying on federal money. We are relying on private pay. So we keep the costs down. But what's been really interesting over the past few years is that assisted livings have been popping up everywhere. There's an assisted living down the street. In my town alone, they're popping up all over. New ones are popping up. There's one down the street from me. There's one down the street from that one. And so the competition is greatly increasing in assisted living. So as an assisted living provider, we have to provide quality care, quality programming, quality food, and quality aesthetics, because we have to compete, but we have to keep the price down. But by doing that, we are making our brand, if you would, more marketable, because then the customer, which is someone who's living there, is going to say, hey, friend, I live in this great community and they have great food, they have great programming, they have great care, the nurses are great, the care staff are great, it's a great place to live. And so more people move in, and then that's how the assisted livings make a profit. Health insurance and medicine right now is not practiced that way, and that's why costs are going up. So we need to get rid of those superficial lines and allow you to buy insurance from anywhere in the country. But what do we do about those who are uninsured? So what we need to do is to bring money back to the states so the states can decide what is best for their those who need that type of insurance. What we have now is kind of like this federal approach, one size fits all, and we know that doesn't work. It doesn't work in life. One size does not fit all. A medium does not fit everyone, and we know that. So what we need to do is we need to be able to give money to the states, and they can decide what to do with that money to help those who need insurance. Furthermore, what we need to do is to cut the burden, the red tape, and the regulation on small businesses, because what ends up happening is small businesses want to help the poor, they want to help those who need food, they want to help those who are homeless, but they can't because the regulations and taxes are too high. By cutting taxes on small businesses and by getting rid of loopholes and regulations, you even the playing field. Why are hospitals and insurance companies getting so big? And why are businesses getting so big in general and small businesses being destroyed more than being created now for the first time ever in American history? It's because the big businesses can really tolerate all the rules and regulations, but the small businesses can't. The lawyers, the lobbyists, the accountants can be paid for by these big companies, but the small businesses can't afford that, and so they're closing. So we need to get rid of all the loopholes, make the playing field even. We need to make it fair. And by doing that, we are allowing small businesses to help those who are in need. We also see that religious institutions, all religions that want to help the poor, can't because they're not receiving as much funding from their congregation, and that's because the congregation is also being taxed. So there's a lot to really look at here, but if we move to a privatized system with localized aid for those who need it, we can better help those who need the insurance, who can't afford it, but also make insurance more affordable for everyone. We know that deductibles have gone up tremendously by thousands of dollars by the year of 2017 next year, which is very upsetting. So that's something we really need to look at. I hope this has shed light onto kind of a way to make health insurance and medicine more affordable. It's kind of a quick dumbed down version of really the complexity of it, but it doesn't need to be that complex. And that's what's great about what's moving forward, what we're seeing currently. We're starting to see the desire for change, the desire for Obamacare to be changed, because Obamacare, though it had good intentions, did not really work. And what we've seen too is that Obamacare has started to fine hospitals for readmits within 30 days. And that's something I wanted to talk about real quick as well. I don't want to keep you for too long because we're almost at 10 minutes here. But when someone is admitted to the hospital, let's say someone who's on Medicare is admitted to the hospital with a UTI. I'm using an example to be quick and easy. And then they leave the hospital but are readmitted within 30 days for the UTI. Medicare says we're not paying for that. So what does the hospital do? The hospital has now created a new position for social workers, and their main goal is to make sure that that person is not readmitted within 30 days because the hospital is not going to get paid. But what does that do? It increased the cost of healthcare. It increased the cost of your hospital stay because they have to hire more people to make sure you're not readmitted. Government had a good intention because they wanted us to be able to take care of that person, but it created a bad result, and that's increasing the cost of healthcare. Furthermore, hospitals do not list how much things cost. There is a few places now that are privatizing their health practice, particularly outpatient surgical centers we've seen have privatized their practice, and also doctors' offices that don't accept insurance at all, and you pay out of pocket, but the costs are down because they want to be competitive. And how do they do that? They list every single item that you would need for a surgery. They list how much the catheter costs. If you need an IV drip solution, they're going to list how much that IV drip solution, each bag costs, how much it costs for the pads that the pads you're going to need, the band-aids you're going to use, how much each visit is by the doctor, how much your dietary consult is, how much the consult with the physician is going to cost, how much the food costs, how much the tubing for the IV costs, how much the anesthesia costs, how much sanitation costs for the equipment in the surgical room. And so as a result, the costs are kept down because they want you to know that you're getting quality care for quality dollar. And hospitals don't do that because they receive money from insurance companies. And so they don't care how much they charge you because you don't really know how much it costs, do you? So just something to think about. And I'm really looking forward to next year when Obamacare is really looked at, repealed, and replaced with something newer, something better that's going to provide quality care for all of us, even those who can't afford it. My name is Christopher Doran, and I am ending this video. Any questions or comments, it's a free discussion, comment below, and I'm happy to take questions.